Hello, everyone. This is Dr. Andrew Campbell. We're going to go over some actual test results of patients and help you understand what they mean and why you may be feeling ill and what are your symptoms mean and where do they come from? Is this coming from where you live today or where you lived before? All those kinds of questions. So let's get started. First, this is who I am, and I'm the editor-in-chief of 4 medical journals, and one has just been added on. I do a lot of work, I've published over 100 studies on mold and various other things in medicine. I have chapters in medical textbooks. I also have lectured at medical schools, 6 different medical schools. So when you see these experts on the internet, ask them if they've ever lectured at a medical school, because for that you have to have very, very solid credentials. Ask them, and you'll be surprised at the answer. Okay, so all this information I'm giving you here is to educate you and help you understand there is no money involved. You don't have to buy anything from me, etc. Let's go and dive in. And this is a disclaimer, which I guess everybody should put on there when discussing health issues. What is the best way to deal with problems in medicine in general, but especially when you're dealing with toxins? The first step is detect the cause. What is causing your symptoms? Where are they coming from? Why? Second, you remove the cause. And third, you repair the damage. This is one of my first slides anywhere I lecture. And let me give you some common sense here. Obviously, you have the wrong diagnosis and the wrong treatment. Or say you have even the right diagnosis, but you're not given the correct and right treatment, you're not going to get well. You're going to be sick longer. You're going to become more and more sensitive to the point where everything is affected. You can't take anything because it makes you feel horrible. But if you have the right diagnosis and you give the right treatment, the patient gets well and is no longer sensitive. So let's look at just a couple of pictures of molds. One is from behind the fridge. Not many people take the fridge out, pull it out, and see what's behind. Or, as in this case, look at behind the stove. Well, that's pretty impressive too. There was all this mold growing. So something, just so you understand, indoor mold spores. Molds are like plants. Plants produce seeds. Molds produce spores. And these spores induce persistent changes in inflammatory and immune response. And when you're chronically exposed, you get chronic inflammation. Now, here's an important point, and that is the spores of these toxic molds contain mycotoxins, not the mold, the spores. And mycotoxins associated with spores are likely to be absorbed through the respiratory tract and then go on to other parts. The other place that it gets into is also through the nasal sinuses. And this was published how many years ago? You can see that it's been known for those who read medical journals, of course. Those who don't know any of this. So let's go into medical issues. Here's some common questions that people ask me. And I want to show you how this relates to what is coming up, which is the actual test results, okay? If I move out of the moldy place, will that lower the results on the test report or will that change it? I just moved, etc. No, this is not a thermometer. You know, you go inside, you go to another room, and it's a different temperature in that room. So you turn the air conditioning up or down. No, that's not how this works. No, the mycotoxins are molecules. They're the same size as a COVID virus. They stay even if you move to the other side of the world, unless you're treated. Okay. And if you want to know how to treat it, follow me a little further on. How do my test results compare to other people? Is it really pretty bad, or is it pretty low, or how is it really? Well, I'm sorry, folks. Everyone's immune system is unique and different, like a fingerprint, so you can't compare. Do you know of couples who get the flu and one is sick for 2 days and the other is laid up in bed for a week? Same flu, different immune systems. So you can't compare people. I've treated patients, mom, dad, and 5 kids, all under the age of 15, and every test result was different. Thank God we're all different, folks. I'm sorry, let me go back. So that kind of covers this area. And now I lived in a moldy place 5 years ago. Will the test still show anything? Of course, unless you had the right and correct treatment. What do I mean by the right and correct treatment? Not all the Shoemaker, Nathan, all this other kind of business, because those don't work. And I'm going to show you why in just a minute. How does this compare to urine testing? Okay, so here we come up. Here's the next slide. This is from a publication in October 2 years ago. Okay, in the journal Toxins, and it says the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. Well, what do they say about urine testing? Okay, the variability of mycotoxins concentration in urine and its volume based on a daily intake demands urine sampling at different time points during the day and the normalization of results with creatinine concentration. So they're saying one sample is not enough. You got to do it several times through the day. But then they follow it up and they say the inter-individual comparison of mycotoxins is challenging because various factors such as gender, age, diet, muscle mass can influence creatinine secretion. So there it is, folks. Do you want something they have to do several times a day, or do you want something that comes with significant accuracy, precision, and specificity? Obviously, that's what you want. Let's get into the test. On the left, you see a IgG antibodies, and on the right, you see IgE antibodies. What do those mean? Remember, these are toxins. In medicine, in microbiology, we were taught we have 4 pathogens: bacteria, viruses, pathogenic fungi, and parasites. Why? Because fungi or molds, that's like saying car or automobile. Molds can produce disease in and of themselves. Serious diseases, such as pulmonary aspergillosis in the lungs, or what we call nuisance problems, such as athlete's foot, jock itch, etc. Skin issues, which are easily taken care of. Now, if you have an exposure to mold and you got sick from it, sometime in your life, it could have been at summer camp, it could have been in the apartment you lived in 10 years ago, your IgG antibodies are going to be elevated for molds. This is mycotoxins. It's different. Let me take it a little further. All those 4 pathogens, bacteria, viruses, parasites, and pathogenic fungi, are living organisms. They have cell walls, etc. Mycotoxins are molecule. Toxins in general are just a molecule. Mercury is just a molecule. Arsenic is just a molecule. Okay. Roundup, the famous Roundup that's come to attention lately, is a molecule. Mycotoxins are molecules. So they're not alive. They don't have cell walls. So the immune reaction is very different to that of a pathogen. So in this case, an IgG antibody indicates which mycotoxin you have in your body currently and how much you have of that. It's a quantitative test. So as you see here, this person has a lot of mycophenolic acid that comes from penicillium, has satratoxin, verrucorin, etc. And remember, these are cumulative. So just because there's only one high, it doesn't matter. And you see the thin light blue column all the way on the left here? That indicates what is normal level. Anything to the right of that is abnormal, is positive. How much mercury is it okay to have? None. How much of any of these mycotoxins is it okay to have? None. So this is a toxic reaction to these 14 mycotoxins. That is these are currently in the body of this person. Let's look at IgE. IgE in general is what people in medicine we're taught are allergies. So, for instance, if you get the skin prick testing and you test positive for molds, means you're allergic to that mold. What does that mean, allergic? It means stuffy nose, itchy throat, watery eyes when you're exposed to whatever that mold is. These, again, are mycotoxins. The immune response is different. Both are mediated by mast cells. What I mean by both the allergy to molds and the toxicity, IgE, to molds. However, instead of producing all these allergies, when it's a mycotoxin, it's only a molecule, the response is by the mast cells to release a number of pro-inflammatory cytokines. Pro-inflammatory cytokines like interleukins, in particular interleukin 6, which we know is a precursor to autoimmunity, and they found interleukin 6, IL-6, in the fluid in joints of patients who have rheumatoid arthritis. So this indicates on the right that this person is having mast cell activity or reactivity. This is a mast cell reaction. Let's look at the next one so you get a better feel. Look at how much on the IgG antibodies on the left one this person has. Obviously, they're having a lot of symptoms and are very ill. On the right side, it's not that high, so the mast cells aren't going to be as stimulated as on the previous one. Here's the previous one, and here's the current one. It's still being stimulated, but not as much. And what does that stimulation look like? Where do mast cells affect humans? Principally the brain, the gut, and they're just underneath the skin. And those are principally where the effects of mast cell reactivity is from these mycotoxins or from toxins. All right, let's go to the next one. Now here you see on the right a lot of activation of mast cells. when you get a lot of activations of mast cells, that can lead to mast cell activation disease, mast cell activation syndrome, and even mastocytosis. So when we're seeing this picture, this person not only has IgG, the toxic reaction currently going on, but has a lot of mast cell reactivity. These are the patients that are very sensitive, and therefore the treatment has to be adjusted. Any patients with mast cell reactivity is obviously going to need an H1 and an H2 blocker. Here's another patient. You can see there's both activity in the IgG side, and there's some on the IgE as well, with two that really are pretty strong. One is Aspergillus hemolysin, which comes from the mold Aspergillus, and then there's the mycophenolic acid from penicillin. Now, a question I commonly get, how come they're not the same? Because, folks, this is Ig antibodies, IgG and IgE are no relationship to each other. One doesn't follow the footsteps of the other. They're totally independent reactions. So let's take it to the next one. Here again, we have a lot of IgG reactivity. What does this mean? What can this mean? It tells me this patient has a lot of mold, toxic mold, mycotoxins in them currently. But if you look on the right side, there's not that much activity on the IgE. So this is possibly a colonization. In other words, the patient lived somewhere, and these mold spores came into the patient and started living in the patient, more or less. They colonized the patient. For example, Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery, the Mayo Clinic, published a study on 210 patients with chronic sinusitis. Took them to the OR, removed the gunk that was there obstructing their sinuses, and sent it to the lab, asking the lab to tell him what is the most common thing they found that caused this problem. The response was 96% of those 210, it was due to the mold spores. So that would fit into this. Now, what's another place that molds can colonize? The lungs, mold spores, the lungs. Okay. So this gives you an example of colonization. Here's another example, but on this one, the IgE is also elevated. IgE in this particular case with the IgG indicates that this patient is toxic and currently being exposed as well. If there is, let's go up here. This would tell me that the patient is not currently being exposed, okay? This very much currently exposed. Currently exposed. Not so. Again, maybe some, but not too much. And folks, it doesn't have to be in the home. It can be in the gym. It can be that you moved out of a moldy place and brought your pillows with you and cushions and some furniture and bedding and towels and clothes. Those all can carry mold spores. Important. Retest after 6 months of treatment. And what you use is the MyMycoLab's test, and it's available internationally. So it's 14 on the left and on the right. So you get a complete picture, and these are for each. They're not grouped and bunched up. Now, if you notice, aflatoxin is not included. Here's a study published, again, this is a published study. This is looking at the HVAC ducts, refrigerator, compressor, and HVAC air filter. Do you see at the very top, it says aflatoxin, ochratoxin, and trichothecenes. I want you to see that there are 0 aflatoxins because you don't find them indoors. So how do you get them? Ochratoxin, yes. Trichothecene, yes, as well. This is from slides that Dr. Vajdani showed at the last 2023 A4M medical conference in Las Vegas. And this is from this study. Several popular organic acid tests claim to detect imbalances in the gut bacteria and molds, but most of these microbial markers on these tests do not measure what they claim to. So those oat tests, forget about them. They're inaccurate and they're no good. Here's another slide, also from Dr. Vajdani, who has a PhD in immunology, has published over 200 studies, and is a professor, lectures at a medical school in California. Chemical antibodies in blood versus chemical presence in urine. Many labs focus on level of chemicals measured in urine, but this is an indication of the chemical that's already passed out of the body. It's gone. You should measure what's in the body, okay? So practitioners can thus examine the role of chemical-induced neoantigen formation in the development of autoimmunity, because that's what they can cause. So look for body burden of chemicals not in the body, not chemicals coming out of my urine, and that includes mycotoxins. Don't measure what's left the body, measure what is in the body. That is what we call in medicine the body burden. And that is what you want to know so you can know what you're treating. And why do you retest 6 months later? Because 6 months later, it'll be gone, and so will the antibodies. These are molecules. The immune system is different, reacts differently. Here's a study that was published to show you how many tests out there are not worth anything or very little. This was published 4 years ago on these 2 studies. The GI map on the right bottom, the specificity was only 26%. What does that mean? That means 74% was not specific. Don't use these kind of tests for your patients. And here's a patient comment. I have a lot of these. They email me all the time. I'd say about 10 to 15 every day, sometimes 20 a day, 7 days a week. I've watched all your videos and I very much want to use your treatment paradigm. It's formerly seeing a functional medicine doctor, was trained by Neil Nathan, but I have not made progress on this protocol, on his protocol for the last 3 years. Folks, it takes 6 months if you use the correct treatment. Please watch that on my other videos. It's available for free, no charge, and you don't have to buy something. Here was a very interesting comment. For the past 12 months, I've been sharing the MyMycoLab website with all my mold remediation clients and recommend they take the MyMycoLab test. I've learned so much from Dr. Campbell, and I'm so appreciative of the education and providing a real solution. I think it is finally having an impact with all the mold doctors who follow Shoemaker's useless binder protocol. I see many doctors, including Tom O'Brien and Jack Wilson, now discussing mold more and more. I think Shoemaker has single-handedly held up the health of many millions of people around the world. Dr. Campbell is unraveling the damage Shoemaker and his followers have caused. Yes, you're right, I am. I want you to be well again and not take years. You can do it in 6 months. So go to the MyMycoLab YouTube channel and watch the webinars on treatment for toxic molds, Lyme disease, because a lot of people get treated for Lyme disease when what they have is mycotoxins. Autism, autoimmune disorders, multiple sclerosis, breast implant illness, Alzheimer's, Parkinson's. Did you know that in Alzheimer's, Parkinson's, and Lou Gehrig's disease, which is amyotrophic lateral sclerosis, at autopsy in the brains of patients who died with Alzheimer's, Parkinson's, and ALS, Lou Gehrig's disease, 100% of every part of the brain had molds, even the cerebrospinal fluid, when they do a spinal tap. All of it. This is 3 different studies independent of each other showed this. PANS, PANDAS, chronic fatigue syndrome, fibromyalgia, POTS, also EMF sensitivity. All these, and these are always, as you know, folks, from all my videos, these are medical evidence. In other words, what does that mean? In medical school, I was taught, in God we trust, everyone else has to show data. The other thing is, these people all over the internet and social media give their opinion. Well, my pathology professor said, everyone has an opinion, just like everyone has a rectum. Opinions don't count. Anecdotes. Oh, I took this, and within so much time, I was feeling so much better. Folks, I'm sorry, that's not medical evidence. That's just anecdotes, stories. So if you have any questions, email me. Andrew Campbell, MD is my website, and Immune Doctor is my email at gmail.com. If you want the questionnaire, if you want the information on molds and mycotoxins with more than 160 references from medical journals and medical textbooks. Also, the study I published with another colleague, Dr. Leonard Weinstock, molds, mycotoxins, the brain, the gut, and misconceptions, and Lyme disease and mycotoxicosis, how to differentiate between the two, and many others. As I told you earlier, I've published over 100 studies. Ask all these experts how many studies they've published. I don't need them to show me they've published as much as I. Give me 10%. Show me that you've at least published 10 studies. All right. Anyway, folks, this is all for you. Watch my other webinars because you can get better, and I'll keep teaching you. And any healthcare practitioner, I'm happy to teach you every step, and etc. And remember, when you do the test with MyMycoLab, when you get the test results, you get a complimentary Zoom call with me to go over those results. So, hope to see you in my next webinar. Next time we'll have a tea time with me where you can ask me any questions about any medical problems. Alrighty, folks, all the best. Take care. We're having a hurricane come through where I live the next couple of days. We'll see. Thank you, and God bless.